Well, good morning, everyone. I'm sorry that's not going to work. Listen, we're going to have a very long day today. We're going to be in high listening mode. Everybody's going to be very attentive. Let's try to warm the room up a little bit. Good morning. Thank you very much. I'm Alan Leshner. In my day job, I'm the Chief Executive Officer of the American Association for the Advancement of Science, and I'm the executive publisher of the journal Science. And I get the pleasure to be chairing this study and to be chairing this meeting today. And I'd like to not only welcome you, but take a few minutes to set the stage. The task that we're undertaking for the Institute of Medicine and the National Research Council is to develop a public health research agenda to improve knowledge of the causes of gun violence, the interventions that prevent gun violence, and strategies to minimize the public health burden of gun violence. There's a more detailed version of the statement of the task in the information sheet that I hope everybody has picked up, and it'll give you the detail. But let me give you a bit of a sense of the format for today's meeting. I want to start by noting that this is an open meeting. It's on the record. Interested individuals and members of the press have been invited to attend as observers, but please don't misunderstand. This is not a press conference. And we won't be entertaining questions from the floor. Any reporters who want to speak with individual members of the committee are kindly asked to touch base with the staff officer, Patrick Kelly. Raise your hand, Patrick, and should plan to do so during a break. I also want to remind everyone that this is, for us, an information gathering session. That is, that the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone to be mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the Institute of Medicine or the National Research Council, nor should they be interpreted as positions of the committee. But we won't learn if we don't take advantage of the opportunity to ask rather probing questions. But I'll remind you again, please do not misinterpret the questions as forming a premature conclusion. Committee members typically ask probing questions, and they may not be indicative of their personal views, so please don't attribute them in that way. The committee will proceed through today and after today to deliberate thoroughly before we write our report. Once the draft report is written, it has to go through a very rigorous review process conducted by experts who are anonymous to the committee, and then the committee has to respond to the review with appropriate revisions that will satisfy the National Academies Report Review Committee and the chair of the National Research Council before it's considered an IOM-NRC report. So I hope that the context for today is clear. This is an information gathering session, and what's critical is that the committee be able to probe and ask questions and do so freely. I think it would be useful to take a minute and just ask the committee members to sort of go around the room and say who they are. It would be useful if they could mention where they come from, a little bit about their expertise and affiliations, and any past work relevant to the task. I'll set the stage by doing it first myself. So I'm still Alan Leshner, and I'm still the guy from AAAS and Science Magazine. I'm a former director of the U.S. National Institute on Drug Abuse at the National Institutes of Health, and a former deputy director and acting director of the National Institute of Mental Health. I'm a neuroscientist and a psychologist by background. I haven't done any responsible research for 30 years. Ron Kessler, please push the button.
I'm Ron Kessler. I'm a professor of healthcare policy at Harvard Medical School. I'm a social epidemiologist. I do research on the epidemiology of mental disorders, some piece of which relates to mental disorders as risk factors for suicide primarily. And as you know, guns play a big part in suicide. So that's how I come to this undertaking.
Good morning. I'm Don Carlucci. I'm a mechanical engineer by training. I am the Army senior scientist at Picatinny Arsenal in New Jersey. I've written a textbook on ballistics. I'm also an adjunct professor for Stevens Institute of Technology, teaching the mechanical engineering curriculum.
Hello, I'm Lou Arcangeli. I'm from Atlanta, Georgia. I'm a retired Atlanta police officer. I'm a firearm owner. I've been a hunter safety instructor, and that's all.
My name is Steve Hargarden. I'm an emergency physician practicing since 1976, before many of the CAT scans and other technologies of medicine came to fore. My students think I was mentored by people like Osler and other giants in medicine. I'm also currently serving as professor and chair of emergency medicine at the Medical College of Wisconsin. I serve as the director of the Injury Research Center at the Medical College, and also serve as the Associate Dean for Global Health. I bring a background of injury prevention and control, having completed a master's in public health at Johns Hopkins School of Hygiene, now the Bloomberg School of Public Health, as I was just gently reminded. It's important to bring this perspective, and I think this is an important title for our work, is that it's a public health issue, and I'm delighted to be here.
Good morning, I'm Susan Sorensen. I'm here from the University of Pennsylvania, where I'm a professor of social policy, also a professor of health and societies. I've conducted gun-related research, particularly as it associates to violence against women, and also teach a class for about a dozen years called Guns and Health.
Good morning. My name is John Rich. I'm professor and chair of health management and policy at the Drexel University School of Public Health, where I also direct the Center for Nonviolence and Social Justice. I'm a primary care internal medicine physician by training. My work is largely focused on young people in the inner city, particularly trying to understand the perspectives of young people who have been victims of violence and how the consequences of violence and trauma lead them to behaviors that might include retaliation and getting guns, and the larger and longer health effects of trauma in childhood. I've written about this in a book that really retells the stories of young people from their own perspectives.
Good morning, I'm Bruce Altivote, IOM staff.
Pat Kelly, I'm also on the IOM staff.
Good morning, I'm Arlene Lee. I'm staff to the NRC.
I'm David Vlahov. I'm Dean and Professor of the UCSF School of Nursing and Professor of Epidemiology and Biostatistics at the UCSF School of Medicine. I've got about 30 years of research, starting at Johns Hopkins, where I got my PhD, looking at the issues of substance abuse, of mental health, of infectious diseases, and have moved that into population health and into community intervention studies.
I'm Gary Kleck. I'm professor of criminology and criminal justice at Florida State University. I've researched guns and violence for 35 years. I'm the author of 3 or 4 books and a couple of dozen articles on the subject. I've studied homicide, suicide, fatal gun accidents, defensive gun use, the links between offender possession of guns and the consequences of violence, why people own guns, why people support or oppose gun control. And I teach doctoral students about research design, statistical analysis, and survey research methods.
Good morning. I'm Paul Halverson. I'm the State Health Officer at the Arkansas Department of Health. I'm also Professor of Public Health and Medicine, University of Arkansas for Medical Sciences. I also served as the President of the Association of State and Territorial Health Officials, where we led an effort focused on including injury as a public health issue, trying to highlight the importance of injury, the leading cause of death, for all people between the ages of 1 and 44, and certainly gun-related violence plays into, in a prominent way, the burden of injury. So I also have had a previous leadership roles at the Centers for Disease Control and Prevention before going to Arkansas.
I'm Jeff Runge. I'm an emergency physician by training. I spent 20 years practicing emergency medicine in a very busy trauma center and emergency department in North Carolina. My academic activity centered around injury prevention and control, particularly traffic injury. In 2001, I was appointed by the President to become the 12th Administrator of the National Highway Traffic Safety Administration, which is the foremost injury control agency in government. And as a result, have all manner of experience with moving the population towards a safer environment. In 2005, I moved over to be the Assistant Secretary for Homeland Security for Health Affairs. Left in 2008. I'm now an independent consultant. I'm a principal at the Chertoff Group and an adjunct professor of emergency medicine at the University of North Carolina, Chapel Hill.
Good morning. I'm Al Bloomstein. I'm on the faculty of the Heinz College at Carnegie Mellon University. My background is in engineering physics and operations research. I became a criminologist, I think, when I was recruited to head a task force on science and technology for the President's Crime Commission back in the 60s. Have done a variety of research in criminology related to criminal careers, prison population, a wide variety of issues. Recently chaired a national consortium on violence research funded by the National Science Foundation, and have recently been looking at the issue of people with short criminal careers who can't get jobs after they've done their last offense, looking at issues of redemption. I've been, and I served as dean of the Heinz College at one point, and am fascinated to see the discussion that we get today.
Thank you very much. I hope everybody will note that we have a rather distinguished but also an extremely diverse and well-rounded set of committee members who bring tremendous expertise to our task, which we take to be an extremely serious one. I now want to continue with the stage setting a bit by asking Dr. Linda DeGudis, who's the director of the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention, to talk to us about the charge and the context and why are we here, Linda?